Cannabis. I know you've heard of it. Whether the things you've heard are good or bad, I'm here to teach you a little bit both. Today we are going to explore how cannabis consumption may be affecting your overall fitness. Whether you are a medical user, recreational user, or not a user at all, stay tuned for some useful insights into cannabis's effects. So, why do we care? Well, as time goes on, the users of cannabis increase, and thus its effects need to be studied and shared in order to form the growing general population. This specific research presented will help enlighten you on all the positives and negatives of cannabis before and if you decide to use it. So, let's first start with the basics. What is cannabis? Cannabis, also known as marijuana, is a psychoactive drug from the cannabis plant. Its origin is in Central and South Asia, but it has spread since. And the drug has been used for both recreational and medical purposes for centuries. So, how does it work, you ask? Cannabinoids, which is what marijuana turns into when ingested by the body, functions by stimulating the two receptors types called CB1 and CB2, which are both in the endocannabinoid system, a system within the body. The main active ingredient in marijuana is THC, and THC is actually what becomes these cannabinoids. THC's structure is similar to the brain chemical anandamide. Thus, it allows THC is able to be recognized by the brain, and this is what you can see on this slide, THC being recognized by receptors in the body, and allows it to alter brain function because of that similar structure. And this produces a high effect that people refer to. So what does this all have to do with fitness? Well, let's start with the bad. So as we mentioned, the endocannabinoid system exists within the body and consists of endocannabinoids, which are neurotransmitters that bind to cannabinoid receptors. I know these are big words, but bear with me and look at the diagrams to kind of clarify things. So the endocannabinoid system, or the ECS, is an important signaling pathway in humans with involvement in the cardiovascular system. A number of basic studies have shown how activation of these receptors have involvement in the cardiovascular system. As you can see on this photo, it shows how the CB1 and CB2 receptors are tied to functions affecting heart rate, hypertension, and other things that deal with the cardiovascular system. And studies have shown that cannabis use has led to stress that leads to cardiovascular disease, which is not so good. So that sounds bad, but there's more. So, case reports have described arrhythmias, which is a problem with the rate or rhythm of your heartbeat after the use of cannabis. And as you can see, here's a kind of diagram of the difference between a heart without an arrhythmia and a heart with an arrhythmia. And in a review of over 2 million patients in an NIS database, it was found that evidence of arrhythmias in cannabis users has increased nearly twofold between 2010 and 2014, as you can see from this graph, which is likely due to the increased usage of cannabis. Although this seems concrete, aside from some case reports and this specific study, there have been no robust published studies looking at the association between arrhythmias and cannabis. So, now let's get to some positives. So far we've kind of focused on THC, but now we want to move to CBD, which is another ingredient in cannabis. So unlike THC, CBD does not bind to the CB1 or CB2 receptors, and this is kind of a breakdown of its structure versus THC structure. And when CBD is isolated, it has been seen to provide numerous benefits, including improved sleep, skin care benefits, mood boosters, less stress, and most importantly for athletes, pain, which is why there's a motivation of use of CBD for athletes. But still, that being said, there's a lack of concrete studies that clearly show CBD's correlation to these perceived benefits. And compared to other drugs, the data on THC and CBD's effect on fitness is lacking. So now that we've touched on CBD's presumed benefits, let's touch on THC's presumed benefits. So although many people swear by THC and its benefits on recovery, performance, the data simply doesn't back it up. Only 15 published studies have investigated the effects of THC with the association of exercise protocols. Of these studies, none showed any aerobic improvement. Actually, in the studies shown on this slide, people's exercise performance actually decreased after THC use. So in this study you see on the slide, people were given a placebo cigarette and one with THC in it. And it was found that whenever they used the THC cigarette, they had earlier onset angina, which is basically chest pain, and their exercise time reduced by 48%, clearly showing THC had a not positive effect. And I know we were supposed to be kind of positive and talk about the benefits, but to be honest, there's not too many proven benefits of THC on fitness. So now that you've heard the good, the bad, and the mostly ugly details about cannabis, you yourself can form a conclusion. All the data from my research um, points me to the conclusion that athletes or anyone interested in keeping their fitness up should stay away from THC. On the other hand, I strongly encourage these people to look into CBD, which is legal everywhere and a great proven way to recover. Please check out these image sources for more details on the images and also these research sources if you want to get more information. Thanks for watching and come back for more fascinating videos.